Hey guys, today Jaden and I are going to be sharing some of what we have learned this semester about Lillian Wald, an incredible figure in nursing history. She is responsible for coining the term public health nurse. She really chose this term, she said, because of the community value that it placed on the work of a nurse and how important it is for a nurse to understand the social and economic aspects of life that really affect people's health. As an advocate for the working class, she was a huge innovator in the area of healthcare because she understood that people have to be met on more than just one level. So you can't just treat their health without realizing all these other underlying problems, such as terrible working conditions. So a little bit of historical context is really helpful in understanding a lot of the work that Lillian Wald did. So we're talking post-industrial revolution. So there are a ton of new factories and a lot of people are moving to big cities such as New York, where Lillian Wald did most of her work. And so a lot of these people, they just end up in these huge overcrowded cities with poor working conditions. There were issues like child labor, and there was little or no health care for the working class. And as you can see, this new era has really just ushered in a new set of problems. And so in the rest of this presentation, Jaden and I are really going to hopefully go over some of the ways that Lillian Wald was able to address many of these new problems that society was facing.
As I'm sure you guys are coming to the conclusion from Hannah's slide on some of the historical context from the times, the conditions that the people in New York had were pretty bad. This is one of the main things that pushed Lillian Wald to start the Henry Street Settlement. The Henry Street Settlement is a not-for-profit social service agency that is actually still in operation today. In this picture that you can see on the slide, there are nurses lined up outside of the Henry Street Settlement ready to go and serve the underserved community of Lower East Side of Manhattan. As mentioned just now, the Henry Street Settlement is located in the Lower East Side of Manhattan and seeks to provide various social services and programs to the underserved people of the area. A lot of people in the area utilize the Henry Street Settlement because it is a place where anyone can go and receive affordable healthcare and education from trained professionals. Prior to the Henry Street Settlement being established, the people would have most likely gone without healthcare simply because they could not afford it or did not have access to it. By establishing the Henry Street Settlement, Wald was taking an active role in fighting against people dying from preventable diseases. As mentioned before, the Henry Street Settlement is a place where people can go not only to receive health care, but to also receive education. At the time, it was not uncommon for people to have only a vague understanding of proper hygiene and sanitation methods, and this would often cause many large outbreaks of disease in these tight-knit communities. The people weren't disregarding standards and protocols on purpose, they simply didn't know any better. Wald was a big believer that in order to combat these large outbreaks, first, people would need to receive an education on proper hygiene practices.
Hey guys, so one of the main ways that Lillian Wald was able to use the Henry Street Settlement was for social reforms. And so on this slide, I've tried to kind of illustrate some of the issues that the working class people had to face, like lack of resources that led to child labor and not having access to healthcare, how the industrialized factory work, they had poor conditions and that led to poor health, and they also had inadequate pay, so they weren't able to pay for healthcare. And then there was child labor, and having child labor would lead the kids to not be able to go to school, of course. And so all of that, just kind of like funneled down into this, just inescapable cycle for people. Kind of like there's these societal problems, and then Wald has these solutions. So there's low pay. She advocated for better pay for the people. There was child labor. She fought against child labor. There was lack of education because kids weren't able to go to school because they had health conditions. So she, worked to have nurses placed in schools. There was poor working conditions. She advocated for better working conditions. So we're going to look at just a couple of the specific things that she was able to do in order to help the people. So The first of these things is vocational education. In this class, this is an actual picture from the Henry Street settlement, a knitting class that they had there. They had different programs such as knitting, housekeeping, wood carving, and even home nursing, where they were able to teach these people just life skills so that they would be able to really help themselves. There's this one, it's a great idea, I think, from an article that I read that really Lillian Wald realized that, we have this idea in our society that people just need to pull themselves up by the bootstraps, but she saw that you have to give the people the bootstraps in order for them to be able to pull themselves up by the bootstraps. So that's really the idea behind these vocational, programs that she had to help train people. The second social reform that we're going to look at today is child labor, and Lillian Wald was really a huge advocate for children and in stopping child labor. Like it says on this slide, she called it child labor the humiliation of America at that time. And one thing that is really incredible and just shows the importance of political activism is that one of the ways that Wald advocated for the working children was through the National Child Labor Committee, which was actually eventually responsible for legislation that banned child labor. So just kind of seeing how her work was able to come to such great fruition, and it's really an encouragement to us to fight for legislation for things that will improve the lives of other people.
Another really big part of Wald's career and stuff that she did for nursing that I think is really important to talk about is the standards that she left for education in terms of the curriculum, in terms of what you had to do in order to be considered a nurse ready to go and care for the general public. So around the time that Wald was really gaining some influence and some power in terms of the communities and nursing in general, there really wasn't a set amount of hours or years or really anything for what constituted being able to go out and be a nurse. So depending on where you got trained, that they really could set the standards for what they wanted to do in order for you to be a nurse. And I think especially in this class, with the majority of us being future nurses or nursing students as we are right now, I think we can all attest to pretty much now every single standard and program is pretty normal in terms of you're going to expect to, if you're getting a BSN, spend about 4 years working towards your program or your degree, or at least having some undergrad years, but traditional BSN versus an RN, or the amount of years is pretty established and set between each program, versus back when Wald was starting everything, there really wasn't a set amount of years that you had to spend, or even a set amount of hours that you had to put in before you were able to specialize in a specific area of nursing. And a big way that Wald really focused on this was through the Henry Street settlement. So with education for nurses and future nurses, and I know I even have a picture on this slide, is nurses going to the Henry Street settlement to get educated from Wald and really receive some training there. And they really did set a big precedent on terms of setting the standard for what nursing education looks like, or what at least it should look like going forward. And some of those things, as I mentioned before, have really rippled through to even today, where we see that nursing education is pretty standard depending on, regardless of what program you're in or where you're going to school. And then this also leads into Wald's work as a public health nurse. So at the time, there really wasn't anything known as public health nursing, but Wald really believed that just because you might be considered low class, it didn't necessarily mean that you deserved low level of education and or low level of trained help from professionals. So even if you couldn't afford health care, she still believed that the people who are helping provide that for you should be trained and educated to a level that is deemed sufficient. So at the time, like, children would be sent home from school if they had any even minor ailments. So like getting trained medical professionals, specifically nurses, as in like the public health school nurses, like into the schools, it really helped with education for children, and also keeping those kids in school as long as they could, because the first line of defense, they don't have to be sent home for any minor issues. And a big part with public health nursing is that it really went beyond what people believed to be the normal scope of work for nurses at the time. So because of this, Wald did face quite a few barriers in terms of, depending on what area you were going into, for the underserved communities, they're very tight-knit communities. So language and special customs and social context are all different depending on what slight sub area you might be in, specifically in New York, and even some of that can be seen today, because different areas, depending on where you're in, you're going to get a very different group of people. And then also just at the time, social norms, it was not normal for women to be able to go and really see these kind of people, do this kind of work. And so Wald really did break a lot of barriers through what she did for nursing as a field in general.
Another incredible accomplishment of Lillian Wald's is that she was able to convince the Metropolitan Life Insurance Company that it would be in their best interest to pay for visiting nurses to visit sick policyholders, because she theorized it would lower the deaths and thereby decrease costs for the company. Well, as it turns out, she was right, and it did decrease costs for the company by lowering the number of people who died. And what was so incredible about this is that it really extended the reach of the visiting nurse so much, because they were receiving funding from these insurance companies, and it made it possible for them to reach a much greater population.
Well, to wrap up our presentation to you guys about Lillian Wald, I think it's really, really fair to state that given the historical and social context and some of the things that Wald faced, she really did do a lot for nursing as a whole, in terms of what she did with the Henry Street settlement and nursing education, and for child labor laws, and for so many other things. I think it's understandable why Hannah and I both chose to write our papers on Lillian Wald, and we could go on for a lot longer about lots of the other different things that she did, but I think in general, just the ways that she's helped progress nursing and all the work that she is able to do at her time, it was remarkable, and it should be inspiring to every single one of us in this class to see that it really is possible to make a change, and that we should all aspire to really care about our patients and the general public the way that Wald did. So thank you guys again for taking time to watch Hannah and I's presentation. I hope you guys all learned a little something about Lillian Wald today. Thanks, guys.